Hello, welcome. I'm Sam Wymer, co-founder of The Body Doctor, and I'm very pleased to be joined by Pham, inventor of Zest. Say I'm your patient.
Right.
So I've come into clinic. You've clinically identified that I have a problem.
Right. Like
So,
blepharitis or something.
Blepharitis,
Right.
Demodex infestation,
Right.
overall dry eye. I'm complaining of irritation.
Right.
How would you best recommend Zest as a treatment?
Right. So whenever I see a patient first time, right, it's always thinking about the patient first. So what patients want is how do I get better and how do I get better fast?
Yeah.
And so those are my two primary objectives. And first, I need to let you understand what's going on. So let's say you have a blepharitis, right? It's a hard term to understand. Most people don't really see all the medical terminology. So you gotta simplify it in such a way that it's easy for them to understand. So with blepharitis, I simply say there's something wrong with your lid and it's inflamed, right? The markers for that, of course, is the redness, swelling, itch, grittiness, right? And so that's what you have, and that's what you want to get rid of. And I'm going to present to you options for it. And these options can vary, and we have lots of options for treating blepharitis, right?
Mm-hmm.
Some are better than others, some are more costly than others,
Yeah.
some take more time than others. And so for this blepharitis there, I'll just give you several options. You tell me what you want to do. We can give you a topical steroid, antibiotic combination, right?
Yeah.
You have to go to the pharmacy and grab it.
Yeah.
We can give you a simple procedure in the office that takes 5 to 10 minutes, right? You can do it
Zest.
today. And Zest, for example, get better within minutes, right? And I would avoid giving too many options because that just causes more confusion.
Yeah.
So those are your two options. What would you like, Sam?
So keep it simple,
Yeah.
be effective,
Yeah.
be confident in what we're saying.
Exactly.
Perfect. Obviously, you've done a lot of Zest treatments over the years.
Yes, I think I've probably done the most in the world now.
Probably. I think I'll give you a run for your money.
Yeah.
But yeah, you are probably being. So, what's your top tips for making or incorporating Zest into a clinic a success? How would you do that?
Yeah, I think it starts off first with having that confidence to be able to diagnose the clinical problems that exist, right? Once you have that, there are two other things that you need. You gotta have the basically the armamentarium that is actually to deliver the clinical effectiveness, right? And you gotta have some sort of protocol or algorithm that you can follow, so it's not too confusing not for yourself because you have all the confidence in the world, but for your staff and your patients to understand, and because you have to have everyone on the same page.
Yes. So communication between,
It's not just us, it's the entire team.
Yeah, so dispensing opticians all the
Right,
way
exactly.
to optometry and everyone in between, basically.
Right.
So obviously Zest isn't a one-time, you have it once and then you never see that patient again. So how do you recommend the follow-up appointments? Are we saying, come and see me in 3 months, 6 months? Is it depending on severity? How do you handle those repeat visits?
Yeah, so most patients present us for something that's chronic, right? It's not like they got some foreign body in the eye, you take it out once and then you have to see us again. But having said that, most patients need chronic care just like for dental hygiene, right? It's not like we go to the dentist once to do a deep cleaning for us and we're done, never have to brush our teeth again. Yeah, so usually when I do a Zest, I always tell the patient that we just did perform this procedure, you're obviously feeling much better, but you have a chronic problem that's going to require daily maintenance therapy. And that maintenance therapy depends basically on patient responsibility. The patient has to take charge for their own health. And so that depends on a protocol for daily hygiene.
Yeah, so like you say, it's not a case of, you go to see a hygienist,
right?
And then you don't
go
brush
home
your
and you're
teeth
done.
and you're finished.
Yeah, life is easy.
So it's kind of like the Zest is the hygienist model,
Right.
but you brushing your teeth is your at-home maintenance.
Right, exactly.
Hot contrast.
Yeah, again, it gets
lip
back
wipes.
to the entire process, right? You have to bring the whole team together. In this case, the patient is the team.
So on that basis, then, the more you at home look after your, comply with at-home maintenance,
Right.
it's probably less frequently required for a Zest treatment. So it would probably prolong or hold the relief of Zest longer the more compliant you are at home.
Exactly, yeah. Even with that, I always recommend that we repeat the Zest about every 6 months or so for the very simple reason that even with daily home maintenance, there's plaque that develops deep and on the lid margin that's really tough to clean off at home. And so if they come back every 6 months, we can really optimize that lid health.
Yeah, and we're obviously targeting that inflammation.
Exactly.
That is, dry eye is, unfortunately, there is no magic cure.
Right.
This is a management of the disease, and it's how well we as patients would manage that will ultimately depend how often we have to come back.
Right.
But you typically think, 3 to 6 months?
Yeah, exactly, that's
3
right.
to 6 months for a revisit. Well, this is a good one. So, any important advice tips? So I'm now a new clinician. I've just taken Zest. What is the advice that you would give me to make sure that I use Zest correctly and effectively on patients?
Right. I think the first key is to be comfortable with using it and who to use it on. And that just takes time and experience. But it starts with, they always say that a journey of 1,000 miles starts with one step.
Okay.
And so the first step, of course, is to get the Zest into the practice.
Yeah.
To first start off easy and do simple patients first, the one with the basic blepharitis and the Demodex. Get comfortable in managing and treating that with the Zest. See them back in a week or so that you can see their response to the Zest. Right, we already know the response immediately, it's phenomenal, but there's a secondary issue that we have to also address, and it gets back to that team model, is that we have to make sure that the patient as a team member is actually complying with our recommendation. If we wait too long to see them again, they start losing interest.
So that's back to the, depending on how compliant,
Exactly.
3 to 6 months. So obviously we talk about blepharitis and a Demodex infestation. Is there anything else that can be used with or used to help manage?
Yeah, so Zest is a really broad option for almost anything that walks into office on a medical basis there. So I always say that anything that has redness, swelling, itch, or pain, Zest is going to be useful for it. So they can come in with an acute sty, right? Where you have basically a inflammation on the lid that's marked by this red mound that's swollen and very tender. With the Zest, you can actually calm that inflammation down, reduce that swelling and discomfort. That's just one of many, right?
So, I'm going to reverse it then. Is there any patient that shouldn't have Zest?
Luckily, it's really rare that you could have a contraindication to Zest just because it really calms down the lid inflammation there. And so basically, any patient that is able to sit still comfortably for the procedure is going to be a candidate, whether they're very young or very old. Certainly if they have a known allergy to one of the ingredients in Zest, then perhaps you should try it maybe on the back of the ear just to see if there's a reaction. And if there isn't, then obviously even if the quote-unquote known allergy, it actually is not happening with the gel.
I don't know anyone with an ochre allergy.
It's rare.
But then again, I don't usually ask that.
Right, there's always going to be someone somewhere allergic to something.
I'm sure. What are the benefits of Zest ahead of surgery or a referral to surgery?
I think this is one of the most unmet need in surgical care. And the reason it's been unmet for so long is before Zest, there really wasn't any great option for managing pre-surgical patients. We all know that pre-surgical patients, the biggest issue is lid care. That's the number one failure for a glaucoma surgery, LASIK surgery, or cataract surgery is poor lid health. And before, it would take a lot of time to do it would cost a lot to do it, and it would be very uncomfortable for the patient to have it done. But now with the Zest procedure, it literally takes a few minutes. You're able to optimize that lid health. You get a much better lid quality, and the cornea. If you're doing cataract surgery, obviously your keratometry reading is going to be much more stable and accurate.
So it probably reduces the risk of refractive surprise.
Exactly. Yes.
So it actually could be a cost saving.
Very much so.
And obviously time management.
Obviously, and quality for the patients, because having to redo cataract surgery is the last thing any surgeon wants.
Absolutely. IPL. Okay, so obviously
a very popular procedure these days.
It's getting more and more popular. More and more clinics coming on board. It's a wonderful.
It works great.
Kit.
Yes.
So is there a benefit of utilizing Zest in accordance with IPL, or is it like either do Zest or do IPL? What do you think?
I think this is where you have a tandem benefit there, where we all know the IPL works wonderfully, but one of the main challenges of IPL is there's always this time discrepancy between treatment and treatment effect, right? We know that if you deliver IPL, the patients won't feel anything until the third or even the fourth IPL session, and now you're looking at 6 to 8 weeks after the initial treatment. And most patients, if they're not feeling any benefit, they're unlikely to continue. And so if you actually do a Zest, you get a two-pronged positive outcome. One, you're able to deliver that immediate effect. And two, because you're addressing lid health and inflammation, you're going to accentuate the effectiveness of IPL both in the immediate and long-term basis. Especially if you repeat the Zest every 6 months. Again, a lot of clinicians do repeat IPL after the initial 4 sessions or so.
Yeah, because I read somewhere about the biggest cause of dropout is because of patients feeling as though there's no benefit. No benefit, yeah.
Exactly.
So it's kind of like using the Zest as a placebo to a degree, in terms of the patient will think it's the IPL, the expensive IPL.
Almost, session. Yeah, but it's really not a placebo way because there's actually a clinical benefit. In this case, it's actually palpable. Before, the palpability or subjectivity measurement is just not there. Right. And so, and the other benefit of this is that if the patients leave the office after IPL not having that immediate benefit, they're unlikely to refer to friends and family to this procedure that they see no response from.
Which is obviously probably the most successful form of marketing is having that personal recommendation.
Exactly, yeah.
You know, if you're
nothing like self-referral marketing. Yeah.
Tell your friend this is the treatment, and you say, okay, that's the treatment.
Absolutely.
Is there any patient that shouldn't have Zest, in terms of, obviously we've covered off about allergens and things like that. Is there any, let's say, corneal abrasions or anything like that where we want to stay away, let's not get involved, or post-surgery maybe? How long after do we wait? What are you thinking? Yeah,
so obviously there's some contraindication, right? They just had glaucoma surgery, the bleb or the trabeculectomy is really fragile. You don't want to go in, or even after cataract surgery, you don't want to go in the next day there. But certainly after the eye has quieted down, things have healed, you can perform the Zest. And as we already alluded to before, those patients who have allergies to some ingredient may want to test it on another part of the body first before you put it on the eye. And then there's 2 broad categories, which is pretty rare luckily, where Zest will not be effective. The biggest, of course, and very rare, is what we call central neuralgia, where there's pain, chronic pain in the eye that the brain is actually sensing and not the eye itself.
Like deferred pain?
Like a referred pain, but these are the patients who've suffered from a shingles or herpetic infection, or had some sort of severe trauma to the eye, or had LASIK-associated dry eye for so long that there's now a secondary brain response where the brain detects pain from the eye, even though there's no quote-unquote active disease.
And the second then, I presume, is to do with the lacrimal sac, the drainage system.
Yeah, exactly. If the drainage system is not there, it's like having chronic sewage in the eye, right? You can do whatever you want, but until you remove that sewage, it's not going to work very well.
So that would be referred probably into ophthalmology.
Yes, correct.
Certainly in this country, it's referred into ophthalmology.
And the biggest telltale sign of this lacrimal flow problem is when you've tried a number of therapy, a number of treatment, and the patients fail to respond. That's one of the...
So they've been using drops for years.
Yeah, they've been using drops. They tried 10 different treatment regimens. None of them has worked.
So that's probably at that stage you say, look, we're going to refer you in to ophthalmology to take a look.
Correct.
Well, I appreciate your time, Pia. Thank you for obviously supporting us. We are proud to obviously distribute Zest and bring this revolutionary treatment option and management of dry eye to the country.
Yeah, pleasure's all here.